Hi, my name's Nicola. I'm a newly qualified health visitor. I'm currently trained to be a lactation consultant and I'm a mum of 3. I am here today to talk about mastitis. So mastitis has now been classified as a spectrum of conditions. That is, that it ranges from a plug duct all the way to a condition called galactocele, abscesses, phlegmons. So it really does encompass a broad spectrum of conditions. Most people, though, when you speak about mastitis, will think of that red patch on your breast, really painful to feed through, perhaps getting some flu-like symptoms, that kind of illness. So I'm going to talk to you today about that particular side of mastitis. So mastitis, it basically translates to inflammation of the breast. So the Academy of Breastfeeding Medicine revised their mastitis protocol in 2022, and they now say that most mastitis begins as inflammatory mastitis, and that's usually occurs from milk stasis, so milk being in the breast for too long, sitting there. So the ABM protocol talks about a 4-step regime of treating inflammatory mastitis. This is to move away from initially giving antibiotics, because what the research is showing that is it is more likely to be inflammatory to begin with, which then may progress into a bacterial mastitis needing antibiotics. I must say a disclaimer here: if you feel really unwell at all with mastitis, if you have any concerns at all, it is always best to get a healthcare provider, GP, out of hours, whoever that is that you need to access, to have a little look, to have a discussion about your symptoms with. However, if you are going to try the conservative management, then these are the 4 steps that you need to know. So step 1, feed as normal, right? So every historical piece of information would say feed from the affected breast, feed, 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 express. No, you don't need to do that. Just feed as normal. What we don't want to do is cause more milk supply, because what the protocol suggests is that actually hyperlactation, i.e. having an abundance of milk, actually worsens mastitis. So what we want to do is down-regulate that milk. Second is to use ibuprofen. So this is a known anti-inflammatory, and that's going to help to reduce the inflammation in the infected breast. It will also actually help with pain relief, and it will help with any fevers that you are experiencing. Thirdly is to use cool compresses, not warm. So once again, historically, apply heat to the area, but what we know is heat actually causes vasodilation, and that can cause the area to become more swollen. So what we want to do is constrict the area, make that swelling go down. So using cool compresses. Number 4 is to not do really rigorous massage. None of this kneading the breast, none of this getting your vibrating items onto there and digging them in. If you must do any sort of massaging, you want to be stroking like a cat. And I mean, this is very soft movement. And what the ABM protocol suggests is using lymphatic drainage. So I'll do another video on lymphatic drainage. But generally, if you're doing any sort of massage on the breast, it literally just needs to be this kind of very soft touching. Let me know if you've had mastitis. I have had mastitis. I can totally sympathise with you. It is painful, it is horrid. If you have any questions at all, then pop them into the comments, or if you really don't want to, you can pop them in my inbox. That is absolutely fine. If you need any support, then do seek out a local IBCLC, your infant feeding team, GP, as I said, if you're feeling really unwell. You know, if you've got any further suggestions for any videos coming up, and any feedback that you could give me would be great, because this all goes towards my training for my IBCLC qualification. Thanks, guys.